Welcome, everybody. It's Dr. David here from El Paso Manual Physical Therapy, and I hope you're ready to catch the best glute exercises for sitting and standing so that you can avoid a knee replacement surgery. That's what we're going to be talking about today. That's our topic. I'm going to get into that, but before I do, let's see who's here. We're live right now, so there's people live jumping in our comments. Hopefully, I see some of our regulars out there. And in case you haven't noticed, we are in a new studio. We've kind of revamped things a bit. So now we have a blue wall. You'll see more of our studio here in a second. But the main thing here is I want you guys to get help. If you have knee osteoarthritis, especially, this video is going to be for you. So make sure you're ready to go. Who's here? Dr. Lyons is here. She says, hi, everyone. Dr. Dave, EPMPT from Los Angeles. Wink. Fantastic. Thanks for joining us, Dr. Lyons. Julie Parker's here from Sydney, Australia. She says, I am definitely interested in this. I can't stay for the whole thing. I will watch it again when I can. I almost recovered from another backflip. Oh, no. Glad you're feeling better, Julie. And yeah, please, if you can catch our replay. That's something that all of you need to know, just in case you didn't know. This is live right now, but it's recorded and it's living on YouTube or on Facebook, wherever you're catching this. And so you can hit that save button on your video player, wherever you're at, whatever social media channel you're on. And then you can watch it later. You can come back to our account as well and catch the rest of the video in case you don't see this here. Thank you, Julie, for joining us. Cindy's here from Odessa, Texas. She says, hi to all. Welcome back, Cindy. My neighbor down the road, Kimberly, is here. She says, hi, Dr. David. Can't wait. I've been working hard on my glutes. Yes, get those glutes nice and strong, Kimberly. Fantastic. Thanks for joining us, Kimberly. C. Kelly says, I'm in such bad shape, Dr. Dave, that I think I need glutes replacements. I'm sure your glutes are workable. We can work with them and make them better. It's going to take some work, but trust me, you want your glutes. You just want them to work better. And I'm going to help you out with that here today. Great. All right, we got another one here. Tina, she says, hi, Dr. David. I'm from DK and enjoy your good advices. I had a knee replacement in February, and in April, I got a burst Baker cyst and a blood clot in my calf. It was the worst I ever had. Oof, I'm so sorry. What would you recommend for me to exercise to feeling better? I do the one with my toes and the one to lift my heel as you recommend. Thanks a lot in advance, Tina. I'm so sorry, Tina. This is a tough one. Well, given that you had the knee replacement and the Baker cyst, there's obvious signs there that you have had a muscle imbalance affecting you for a long time. So actually the exercises, the glute exercises that I'm going to be talking about today are the number one thing, because where you need to focus, if you haven't figured this out just yet, Tina, is fixing the root muscle imbalance. That's the best long-term fix. That's what's going to get you the best results for the rest of your life. In the short term, it's going to be a lot of pain relieving things, which I'm sure you know plenty of them, as far as like, working with a massage gun. Tailgate swings is one that we recommend a lot as well. Any other pain relieving things that have worked for you in the past could be beneficial. Just have the understanding that they're not going to fix the pain long term. It's just short term. Fixing the muscle imbalance is what needs to happen so that you can. We got this unplugged. So that we can. Sorry, our studio is still brand new, and we have a few things still. We're figuring out a few things here as far as the furniture and that. Anyways, with the muscle imbalance, that's what you have to fix. You have to make sure you fix that muscle imbalance to make your knee replacement last as long as possible and to get the best situation for your Baker cyst and protect that knee from having a knee replacement as well. Great question, Tina. Lori Wilson, hello from Ohio. Welcome back. Thanks for joining us again, Lori. I remember you. Nana is in Las Vegas, Nevada. Osteoarthritis and chronic medial meniscus tears both knees, 71 years old, wave hands. Thanks for joining us, Nana. Hopefully we can help you out today. Anne is in Oregon. Welcome, Anne. Glad you could join us. Fantastic. We have Beth. She says, is this helpful if I'm trying to avoid hip replacement surgery? 1000%, because it's the same muscle imbalance that sets up knee arthritis that also sets up hip arthritis, which people get a hip replacement for very often. And so these exercises are absolutely going to help you. I'm going to bias the talk a little bit more about knee arthritis and avoiding a knee replacement. However, all of this highly, highly pertains to hip arthritis and avoiding a hip replacement? Good question there, Beth. Kim Albright says, hi from New Hampshire. Great, we have the Northeast joining us. Stephanie says, hey, sending love from Germany. Great, thanks for this topic. So helpful since I'm working on my glutes to support my meniscus tear. Awesome, yeah, the meniscus. First, people get a meniscus tear. Oh, before that, people get like kneecap pain, patellofemoral pain syndrome. That happens in our 20s or 30s. And then by 30s to 40s, people start getting a meniscus tear if the same muscle imbalance is still there. And then 40s to 50s and beyond is where people start to get osteoarthritis in their knee joint. It's the same exact problem that sets you up. So this talk is going to be helpful for you too, Stephanie. Thanks for joining us out there in Germany. Great. We have Ravi from Oakland. Great. Have been following you and glad to say I am doing well and hoping to not have surgery. My problem is still a weak left medial glute. Great that you identified the problem. That's a huge deal. Now that you know, because you got to think about this, Robbie. There's so many people that are recommended a knee replacement surgery or a hip replacement surgery for Beth, and they have never been told their glutes are weak. In fact, they get told their quads are weak, which really they're usually not. They're usually over dominant. They're the main muscle that's carrying the weight of the glutes for the job that they're not doing. But now that you've identified that you've got a weak glute, you got some work to do. But if you do that work, you're probably going to feel a lot better and you can potentially avoid the replacement altogether. This map that I'm going to show you today, I'm going to draw kind of a map here, will guide you exactly on where to start working on your glutes. Good comment there from Ravi. Kit Kat says, hello, doctor. Is lying better than sitting for the glutes? What is the best resting position that doesn't inhibit the glutes? Great question. I'm going to talk directly about that today, so stay tuned. That's exactly what the talk's going to be about. Eve says, I've been hoping to catch one of your live chats. I know glutes and lower abs is what I need for my left hip with osteoarthritis plus a torn labrum, and L4, L5, and S1 are moving. I need a custom plan. Please advise. Oh, we'd love to help you out. There's lots. By the way, this is a good point to bring this up. Our helpline is available today. So we'll let you know when we're ready to take calls. So pay attention. We'll flash a phone number here. If you're live with us right now, you'll be able to call that line and we'll get to talking to you. My hope is that if there's something you're stuck on or like in Eve's case here, you want to talk a little bit more about some sort of custom plan, I'm happy to help you. So when we flash that number, be ready to jump on your phone and give us a call. Hopefully I get to talk to you, Eve. Irene is here. She says, I have arthritis in both of my knees. Can I still do the exercise if they are swollen? We're going to talk about that. It's probably a no, but I'll tell you more details on why you shouldn't and when you should, when it's time to start doing the right exercises. Good question there, Irene. Kat says, hi, working on glutes for my meniscus tear. Thank you for your videos. You're welcome, Kat. Thank you for saying that. I appreciate that. Glad you're working on the glutes here. Meniscus tears, we need to fix those so you guys don't get knee arthritis. All right, well, let's get to talking about the topic that we have here. So today we're talking about the best standing and sitting glute exercises to avoid a knee replacement surgery. Glutes are key in fixing knee osteoarthritis and taking the pressures off the knee joint so that you're not progressing your knee osteoarthritis and eventually getting so bad that you need to have a knee replacement. It's completely preventable as long as you have some decent motion in your knee. Even if the pain's really high, even if your x-ray shows that you're stage 1, 2, 3, or even 4, even if you're bone on bone in your knee, the doctor has put up your x-ray and said, look, it's bone on bone knee arthritis in there. We should have done a knee replacement last year. They will tell you that. And we have people that we help, bone on bone, should have had surgery a year ago, that get better once they start working on their glutes. But there's a specific progression and there's some rules that I have for you. I'm going to share them with you right now on how and when to work on your glutes. So let's get into it. Let's start with a better color here. We're going to go green. So rule number 1. Sorry, I'm going to have to, I'm right-handed, so it's working a little funny for me. All right, so this is a question you got to ask yourself Number one, can you consciously, I might have misspelled that, consciously activate your glutes? What I mean by this is when you, right now, wherever you're at, you're going to do this test with me to see if you can pass this test and follow this rule. Wherever you're at, sitting, standing, or lying down, whatever position you're in, if you want to sit, that's probably the easiest way to do this, but you can do this in standing and lying down too. Can you tighten your glutes? Like, can you think to make your glute muscles, or I'm talking about your butt muscles, can they flex? Can you activate them? Can you tighten them on command? This is important because there's a lot of people, I'd say more than half the people that start our program cannot activate their glutes. When they try to activate their glutes, this might be happening to you right now, other muscles activate instead. They get no glute activation or a very poor glute activation, and then it's usually their thigh muscles, their quads on the front of their thighs, or their hamstrings on the back of their thighs, or both, that activate in place of the glutes. This is critical, and I've made it a rule. Let me write rule on here, R in all caps, rule number one. It's so critical because think about it. If you go to do some glute exercise, say in the gym or with your physical therapist, with a trainer, on your own, you're following YouTube videos, you intend to do a glute exercise, but you cannot actively, consciously activate your glutes, then you will fail at that glute exercise because you have not practiced conscious glute activation. So we need to start there first, which I'll get into. Let me just share the second rule here. So rule, kind of already stepped into it a little bit. Rule number two, make sure I have it here. Can you keep other muscles from taking over? That's what I was saying. When you tighten your glutes, can you prevent your thighs from taking over the contraction? So what I want you to do to test these two rules on yourself, tighten your glutes right now wherever you're at, sitting, standing, lying down. Make them tighten up. Go 100%. Hold it for 10 seconds. And think about what muscles are firing. You might put your hands on your lap, on your backside, on your butt muscles, on the back of your thighs, and just feel the tension. What is tensioning up? Because if it's not just your glutes or primarily your glutes, like overwhelmingly your glutes, then you have a muscle imbalance. And when you go do glute exercises, even simple ones, you're not going to be using your glutes. You're going to be using other muscles. This is bad because then it feeds into the muscle imbalances where you're using your thigh muscles too much and over pressurizing your poor knees. And then that's why you have knee arthritis. That's why you have a meniscus tear in your knee. It's estimated that 50 to 90% of people that have knee arthritis have had a meniscus tear, possibly undiagnosed, possibly diagnosed, because it's the same muscle imbalance. Too much pressure from the quads usually. Hamstrings can participate in this too. And the reason why there's too much pressure is because the glutes aren't doing their job and those thigh muscles are compensating. They're taking over the work that your glutes should be doing. Okay, so this is going to keep coming up. That's why I wrote them out, these two rules for you. Now let's talk about that map here. So I'm going to write here, beginner. I tend to misspell things. So y'all can check me in the comments. Let me know if I misspelled something. Advanced. All right. And then here's a little timeline or a spectrum. That would be the better way to put it. It's a spectrum. And what we have at the beginner side over here is just number one. This is the first glute exercise. We have glute activation. That's all I want you to do. This is literally where we start people in our program. We actually have it for free. We have phase 1 for free of the knee arthritis recovery program. It's on our website. Hopefully we can flash the website here. So if you're looking to start our program, because you might be watching YouTube videos like this one, or you might be on Facebook, we have a bunch of videos on YouTube that are kind of lists like this, but we have our program that's very organized. You can see a little commercial of it here. You can apply to join the program. However, phase 1 is available for free at that website right there. You don't have to log in. You don't have to purchase anything. You don't need an account. You just start the video and you're in phase 1, and you could try it out and make sure that it's right for you. And the first exercise, one of the first exercises you're going to see, there's a lot of information because you need to understand rules like this. This is a process. Remember, knee arthritis, fixing it. There's no magic bullet. There's no like, this injection is going to work or this surgery is going to fix it all. That's the way the medical field likes to present it to people, but it's a process. You have to start with education like this and know exactly what to do and when to do it. And at the very beginning, if you didn't pass these rules, then we're starting on glute activation. And all I need you to do is tighten up your glutes and hold it for 10 seconds. You can do it in standing. I'm going to go sit and just show you how it looks sitting. Sitting down right here, and I'm tightening my glutes. You'll see my whole body go up, a half inch or an inch. And it's just because my glutes tensioned up, so they got a little thicker, just like when you flex any other muscle. And what I'm doing here is just feeling my thighs to make sure they're relaxed. What will happen sometimes if you over contract your thighs is your knees will start to straighten out. People start to kick up their feet. That in order to kick up your feet, you have to be using your quads like that. And that's not what we want when we're just trying to activate the glutes. The glutes should just tension up a bit. And then you could do this lying down as well. So you might be lying down on your back like this, and you just tension up your glutes and hold it for 10 seconds. And the point here, you'll start going at 100%. But if you're flexing all these other thigh muscles too, then you need to back down from 100% to 80%, maybe even 50 or 10 or 1%. Just barely activate the muscle, because what you need to go through is the mental gymnastics, the mental practice of only firing your glutes. If you do not go through this, you will fail at rehabilitating your knee arthritis successfully without surgery. It's my strong belief that 99% of people out there signing up for knee replacement surgery have not gone through this. And if they did, they probably would not need the surgery, because it would fix the imbalance and depressurize their knee, and their knees would feel tremendously better, enough for them to say, you know what, I don't think I need this surgery anymore. I can be just fine. But this is just step 1. I have 10 more exercises I'm going to show you. Like I said, this is a process, this is a progression, but this is an important first critical step. And if you were not very good at this, this is where you need to hang out. And this is an exercise, but it's not an exercise in the sense of like, you're going to do this once a day. This needs to be more of like a every hour, every 15 minutes thing, where you're just constantly practicing holding your glutes and thinking about not firing your thigh muscles, so that you can get that conscious control over the right muscles and you can consistently use them in harder exercises. All right, let's come back over here. You guys, type in your questions if you have any on the glute activation. I'm going to go into number 2 next here. Number 2, I'm going to go standing from a chair. Pretty basic thing, because everybody sits at some point, and then you have to stand up and move on to the next thing, or you get tired of sitting. And I'm going to come back over here. Now, this is pretty high, and usually it's easier to get up from higher seats. All of you guys know you probably have a seat that's low somewhere in your house. Sometimes it's the couch, sometimes it's the bed, sometimes it's the commode, the toilet, wherever you're at. You have that chair in your house. What you need to think about, once you get that conscious control, once you've practiced glutes, when you're going to stand up from a chair, here's what I recommend. You're going to put your feet wide, open your knees wide, because when you do that, it positions your glutes in a way to where they're going to be better used. If your knees are together, your feet are together, it takes your glutes out of the motion and forces you to use your quads. So, be careful if you're trying to be modest and all that. Obviously bring your legs together. But if you're in the comfort of your own home, if you have the right clothes on, I recommend you do this right here, so that when you go stand, now that you have that conscious control, you can think right before you stand, you think glutes tighten, and then as you stand up, actively tighten your glutes. So just to show you from a side view here, I'm thinking about opening my legs. I'm thinking about tightening up this muscle right here. And then right as I'm leaning my weight onto my feet, as I'm about to stand up, I'm thinking, come on, glutes, help me up, tighten up, tighten up. And then I'm thinking about squeezing them harder as I stand up. And by the time I'm standing, my glutes should be tensioned. They should be active, firm, assuming you have control of them. That's the key part that gets missed by so much of the medical field. But you guys are going to do this because now you know. Right, so that's exercise number 2. And as you'll notice, I said exercise, but we're not in exercise mode where you go do something for 20 minutes, 40 minutes, or an hour, and you build a sweat. This is a way of life. This is how you have to move. And it needs to become a habit. That's why I tell people to do the glute activation so frequently, so that it just becomes more normal for you, because it feels very abnormal for most people when they start out. And then to have to stop your routine when you're just getting up out of the kitchen table to finish your breakfast and go, clean up, you have to stop for a moment and think, okay, come on, glutes, work. That's how this needs to happen, because you are using your glutes all day, not even thinking about it. And that's what's leading to the demise of your knee joint. That's what's destroying your knee joint, because you have not been in the habit of using your glutes properly. And so we need to start there. All right. Number 3 here. All right. Standing glute activation. I'll just connect them this way. So standing glute activation. Now, I love this one because I'm going to come back over here. When you're going to be standing at times, right? You got to go to the grocery store. You have to wait in line at some point. You have to stand in your house to do the dishes, to fold the laundry, whatever it might be. And it is exercise for you to stand. You don't realize this, but you use muscles when you stand up. It's the way we're built as humans. We're bipedal, which means we stand on 2 legs, not 4, like a dog or a cat or a cow. And our weight it should be efficiently stacked vertically. And when you stand, you should use certain muscles to balance yourself. But what should ideally be working here is your glutes. Your glutes should tighten up in order to bring your hips under your spine and stack everything vertically very, very well. But if your glutes are not working, what tends to happen to people is their hips go back a bit, and that forces you to use your back muscles more and then your thighs more. Therein lies the muscle imbalance. Now, because glutes are weak, thighs are over dominant and back is over dominant, those spinal erector muscles. That's what leads to back problems for a lot of people, and of course, knee arthritis and hip arthritis for a lot of people as well. But if you get into the habit of tightening your glutes and standing this way all the time, when you're just doing your dishes, doing the laundry, talking to somebody, then you'll feel your glutes work and you'll be correcting the imbalance. So this is the 3rd exercise in a row where it's just a consistent habit change that you need to go through in order to make your glutes be the dominant muscle that you use throughout your day for everyday simple activities. This is where we're starting. We're not even in exercise land where go to the gym or lie down on this mat and put on your workout gear, your headband and your sweat gear and get a good sweat. We're not there yet. You need to just activate glutes better. That is step 1 for most people. All right. Now we're going to get into an exercise, like a true legit exercise. Number 4, clamshells, clams. This exercise is given by so many medical professionals out there, especially physical therapists, and it's so commonly incorrectly done. So I'm going to show you how to do this one right. And I do have to give you a disclaimer. I'm giving you the order here. However, some people jump because you might have good glute activation already. And you might be standing up out of a chair just fine. You might need to jump straight to 3 or 4. So just be aware that it's okay for you to do that. You don't have to go through the order. What I want you to do though is if you can't, I want you to check. And if you can't do one of these, stop there and work on it. Start at the beginning, try it. Start at number 1, number 2, number 3. And if you get stuck at one, you can't do it effectively, that's where you need to be working. Okay, let's show you number 4. So here's a clamshell, the way that I teach it. Actually, let me show you how it's incorrectly done commonly. People will usually just be in this position. They're lying down on their side. Your head might be on a pillow or your hand like this, whatever you want. And then they'll just stack their legs on top of each other, knees exactly on top of each other, feet exactly on top of each other. And then they'll just open up their leg. And the idea is you're opening your knees like a clam would open, like an actual animal, the clam shell. And people will just repeat reps like this. And that's how they typically do it. What I want you to do is make sure that you're using your glute muscle, the glute muscle being on the back of your hip, not on the side so much, but more so on the back. Think of it as if I had a back pocket, if I was wearing jeans or pants that had a back pocket and I slipped my hand in that pocket, that muscle that's right just deep to the pocket, that's what I should feel working. Now, if you feel your thigh muscle working on the clamshell, that's not good. That's what a lot of people do. And they especially feel it if they pick up their leg and roll their body back a little bit, as I see people often make the mistake of. Or if you hold right here, you'll feel your thigh muscle working. You've compensated. So what I do to correct for all that, here's the right way to do it, is I tell people roll your upper body kind of forward as if you're going to lie face down, because what that does is it brings your hips forward and it makes this top knee shoot out past the bottom knee a little bit. My feet are still pretty even with each other, but my knee here is passing my bottom knee. My top knee is passing my bottom knee. That's the starting position. Once I'm here, then I'm going to raise my leg, and I'm not coming up as high as I did earlier. Then I'm going to hold it for 10 seconds. This is a 10-second hold for a specific reason I'll get into for a second, in a second, I'm sorry. But as I'm holding here for the 10 seconds, what you should start to feel if you're doing this at home is the back of the hip burning. It should start to work and fatigue and burn. If you cannot feel that, then maybe if you feel it burning somewhere else, like in your thigh or the front of your hip, you're doing something wrong. Something's not right here. You need to make sure that you're rolled forward enough. Women and men tend to have different hip shapes, so you might need to play with how much forward you roll and how or not. You just need to make sure that you have this muscle burning. You can even put your hand back here and kind of shove with your hand forward to maintain the position of your hips, and you'll feel the muscle working under your hand as well. A way to make it slightly harder is when you pick up your knee, don't go higher necessarily. What I would rather you do is pick up your toes, point your toes up toward the ceiling just like this, and that just ratchets up the intensity a bit at the glute, and then consciously think about activating the glute on this one side. And you'll feel the other side, the bottom side, the glute there working too. That happens. That's okay. Some people feel it there more than on the top leg. Either way is fine as long as you're getting the glute to activate, not your thigh, not any other muscle except the glute here. This one isolates pretty well if you can get all the components done correctly. Now, let me tell you about that hold before we move on to the next exercise. And just real quick, let me tell you guys that the helpline is open. There's the phone number right there. So it's 915-200-4159. If you're watching us live right now, you can call. And I'd love to help you out. I'd love to chat with you. So give us a call. We'll leave that number up for a bit while I keep talking here. So about the holding. The reason why I tell people to do a 10-second hold is because of something called the neuromotor units. The nerve and the muscle have a connection that's a neuromotor unit, and we need to improve that connection. Part of the reason why if you broke these rules, if you try to tighten your glutes and they couldn't really activate or other muscles activate, then your nerve to muscle connection is not right. And you can improve it though. The way you improve it is by doing the 10-second hold. If you do not do the 10-second hold and you just do reps on any exercise like the clamshell that I just showed you or whatever exercise you're trying to do, then you're not improving the neuromotor connection. You're just reinforcing the current connection that you have. And that might be to activate the wrong muscle. But if you're concentrating on firing your glutes, you're constraining your body to do the exercise correctly to use your glutes, then you're sending that nerve signal to the muscle and reinforcing it. You're making it stronger. And we need a 10-second hold for that nerve signal to have enough signals down into the muscle and wake up more muscle cells. This will help you better activate glutes in future exercises. But right now, if you're starting out in this lower end of the spectrum where you're doing the beginner exercises, you need to be doing that 10-second hold to get a better glute contraction. It is critical. This is not taught in regular physical therapy. Most doctors don't know about this stuff. They just say, go to the gym and do that glute exercise. In fact, I got some photos here for you because you might go to the gym and see those machines, you know, the machines where you just sit on there and it's got the stack of weights and you put the pin in and you pick a machine based on what the picture looks like. I'm going to show you a picture here. And so you might do this one, the squat press. And if you see the picture in the bottom right corner of the man, it's got the muscles highlighted that you're supposed to work. And it says on there, if you look at the muscles used section in the bottom, it says quadriceps, those are your thighs, gluteus maximus, and hamstrings. But with squat press, with this exercise, you rarely ever use your glutes. It's actually kind of hard to use your glutes. And because if you just look at the picture there, you're going to think, oh, I worked out my glutes. But if you go hard on that exercise, if you do a lot of reps or a lot of weight, it's mainly thigh muscles you're using. It's mainly quadriceps and hamstrings and hardly any glutes. Now, there's another exercise here, the second one, similar idea. This is a leg press machine. It's a similar exercise. You're using it says here glutes, but you're using mainly your hamstrings and your quads. Those are thigh muscles. The hamstrings are on the back of your thighs. The quads, the quadricep muscles are on the front of your thighs, and the glutes are on the back of the hip. But if you're in a seated position, like in this picture, let me show you on the table over here. If you're seated, think about it. You're like this on the machine and you're straightening out just your knees. That's mainly just using your thigh muscles to accomplish straightening out your knee. Your hip is moving a little, so you might get a tiny bit of glute activation, but it's going to largely be thigh muscles working. In order to get your glutes to activate, the best way is to extend your hip, to get your hip out of a seated position. So it's best if you're standing up and straightening out your hips this way, then you can get your glutes to tighten up really, really well. But if you're stuck in a machine that's making you sit and you're just straightening out your knee, you're missing glute activation here, but you're getting a lot of thigh activation. So a better exercise, if you like to do the gym exercises, would be this third picture here. This is like I think it's a donkey kick, a glute machine. You can see the image on the left side. So you're hunched over forward, and then you're kicking one leg back against the plate. This one is a much better exercise to target your glutes. I'll demonstrate over here what this would look like. You'd be in a machine that's kind of like this. There might be a device that you're leaning on right here, a pad or something, and then you're pushing your leg against resistance under your foot this way, and that's making you extend your hip joint right here, which makes you activate the glute. It's not a lot of knee bending or straightening. The knee just kind of stays in the same position, which reduces how much you activate your quads and your hamstrings. However, it is still very possible for you to accomplish that exercise, that glute exercise, misusing your glutes, or use your glutes very little and focus on using your hamstrings, because hamstrings, the back of the thigh, can compensate for the glutes. So that's why it's so critically important that you put yourself to these rules. As you're progressing through exercises here, you have to constantly ask, am I activating my glutes consciously during this exercise? And am I mainly using the glutes, or are other muscles taking over now? Because if you're on one of those gym machines where you intend to work your glutes and you miss using your glutes, you get off that machine and you're like, I don't really feel anything in my glutes. The machine wasn't helping you out. And it's not a bad machine forever. It might work for you better later after you get through some easier exercises. It just depends on how well you activate your glutes as you get into more intense exercise. So you can't assume that every exercise that's designed to be a glute exercise is going to be effective for you. It depends on you and your conscious control and how in how good a shape your glutes are in as the exercises get more intense. Can they hang with you? Can they still work for you in those exercises? Hope this is making sense for you guys. You guys be dropping comments in there so that we can make sure to answer them here in a second. All right, I got one more exercise, and then we'll probably get to comments. Go up this way. Number 5, butt burners. This is like that gym exercise that I was showing you, the machine, the glute exercise. Another name for it is fire hydrants. There's kind of different versions of it. Let me show you what it looks like. Pretty good exercise. However, I like to do holds on this one. So you're going to get on all fours. This isn't a sitting exercise, obviously, but you're not standing. So it's more like exercises where you don't stand the first 5 here. But you're going to be on all fours. You can be on your knuckles, hands flat, whatever's comfortable for you. I like knuckles because it's just better for my wrists. Then what you're going to do is kick one leg upwards like this, a little out. I like to turn my toes out. I like to angle my knee out just a bit because that really isolates the glutes. And then I like to hold on this one, 10-second hold. Now you still have to apply those rules. Are you consciously activating your glute here? Can you make your glute work without a bunch of other muscles taking over and you no longer feeling it in your glutes? If you pass those tests, those rules, then this is a good exercise for you. But if you're doing this exercise and you feel your back muscles up here, or you feel your hamstring muscles in the back of your thighs mainly working, and you can't really get your glutes to activate, this is not a good exercise for you right now. You shouldn't be doing it. You need to go back to some even easier exercises, because then you're just going to feed into the problem and make your knees worse. And you guys got to be advocates for yourself, because your healthcare professionals are very likely not going to ask you these questions about the rules. They're just going to see you do the motion. They're going to see that you're picking up your leg. They're going to see that you're straightening out your legs. And then they're going to say, oh, they're doing it right. They're fine. And then when the weeks pass by, the months pass by that you're in physical therapy and you're feeling worse in your knee, when you came here to hopefully get better, you're going to be saying, I did what you asked. I got on the treadmill. I got on the bike. I did the silly exercises on the table. I got the resistance bands on me. And my knee feels worse. And the reason is because this was never discussed. And you may have never activated your glutes. And it's up to you to learn this information I'm sharing with you right now and apply it. Fixing the arthritis is a process, and it starts with education. All right, guys, let's answer some comments. Who's first here? Let me get a swig of water. Thank you guys for hanging with us and for sending so many comments. Stephanie Koenig says, oh dear, I did everything wrong and was told the wrong thing after my meniscus arthroscopy. No wonder it got worse. Yeah. And let me make a mention about that, because after surgery, whether it's a meniscus surgery, a knee replacement, an ACL reconstruction, some of you guys might have had an ACL injury back in the day, and now you're dealing with arthritis problems. After surgery, it might be appropriate. It likely is appropriate for a short time, to work your quads and to work your hamstrings, because they'll put nerve blocks on those muscles. They'll put medication into those muscles and shut them down, because they don't want those muscles to activate during surgery. And that's appropriate. So the surgeon doesn't want muscles going crazy and your knee joint going crazy when they're trying to operate on you while you're asleep. But after you wake up from surgery, you need those medications to wear off. That's a whole process, of course. For some people, they have trouble with that. But then you need to reactivate those muscles. But once the muscles are active, your quads and your hamstrings, now it's time to fix the imbalance. And most physical therapists aren't aware of this, and they're not going to teach you. They're just going to say, get stronger quads, get stronger hamstrings. Meanwhile, your poor meniscus is getting worse. So you guys got to be careful. Glad you're realizing this, Stephanie. KK Hoffman says, I'm waiting on an MRI for both knees. 2 different accidents within 2 months. I've bought the knee program. While I'm waiting for the swelling to go down, is it okay to do the glute strengthening? Great question. Oh, we have more. My left knee can do the tailgate swing. Is that good to do even if the knee is swollen but it doesn't hurt? My right knee feels like it's catching on something if I bring my knee up or back. Is there another part? Okay, cool. So here's the thing with pain in exercising, it is my strong belief that you should not have increased pain during exercise. So KK, make sure that you are thinking about how your knee feels as you're exercising, even if it's a tailgate swing. Tailgate swing is a really easy exercise, hardly hurts any people, but some people do get worse pain or swelling. If your swelling is getting worse later on, then maybe you're doing too much of it. And here's the thing, some exercise that is really good for you right now, you might only be able to tolerate a bit of it. So, like tailgate swings, I tell people to do that one hourly, but if you do it 3 or 4 times, every hour, you're doing it every hour, you get through 3 or 4 hours, and it's feeling like it's starting to hurt, or maybe your knees wanting to swell, it's getting hotter or inflamed, then that might be it for today. But the next day, see if you can do that again, and maybe even a bit more. You have to just read how things are going. And I would double check that you don't need to be offloading, because offloading might be where you need to start. For a lot of people, while they're dealing with a painful knee joint, they're trying to get to exercise. They're trying to just start with these exercises here, and you should be offloading because it's painful for you to just walk around right now. For you to just get up and go to the bathroom, or get up and go to the kitchen, or go to work, do your daily activities, you're hobbling around, walking on pain, on a painful knee joint or hip joint, and making it worse doing that. And you're telling yourself, I need to exercise this away, but you need to first offload it to get the inflammation down so that your knee joint can tolerate some exercise. Right now, good exercise for you might not be tolerated, and you need to back off on just putting any weight through your knee joint. So go get some crutches out, go get a walker, go get a cane. Might need to be on these. I only have one right now. We lent one out, but 2 of them ideally. That way, you're not aggravating the joint as time goes on. Good question there. Stephanie says, but sometimes the pain comes a day later. Yes, and that might be something you need to just note. A lot of people, they have pain right away during exercise, or right away during a certain activity, or immediately after, like minutes afterwards. You're lucky if you have feedback like that, but some of you guys get delayed pain. And that's usually due to nerve irritation, number one, or a cartilage injury. Some cartilage injuries will have a delayed effect like that. So you just have to figure out which one you have and connect the patterns. You have to start to say, okay, if I was on my feet this much, if I was doing this activity, I felt fine then, but then the next morning or 24 hours later, then I hurt. You need to start connecting what it is during your day that you're doing or not doing. Maybe you reduced activity, and that could also be a bad thing, because you do need to do something most of the time. It's okay for you to get around, but not too much, that kind of thing. You have to do relative rest. You have to figure out the patterns here to best understand how to manage your pain in the beginning stages. I talk all about that in phase 1, which is free, on our website. Robert says, what about the hip thrusts, where there's a bar across your lap you see people doing at the gym? Yeah, that's a good exercise, but it's on this end over here. Because think about it, you put a bar across your gym, that exercise is advanced. You're putting at least 45 pounds. If you have a smaller bar, maybe less, but 10, 20 pounds on the low end. But it requires you to have good conscious glute activation and not overcompensate with other muscles. It is a great glute isolating exercise. However, you need to have confidence that you can activate your glutes primarily during that exercise. And a lot of people, when they add the weight on more and more, they start doing too much exercise. So yeah, maybe we can demonstrate it. You know what? There's a barbell in the manager's office that I forgot to bring down. If you guys can help me out with that, we'll need that a bit later. Hopefully we can demonstrate that for you later, Robert. Thanks for asking that. Julie says, I've been told I have too much curve in the base of my back. That's great, Julie. Maybe. Do you have back pain? We'd have to start there. So whenever people get told they have too much curve or too little curve, I always question that, because I have to pair it with, is it just your genetics? That's the way you're built. Maybe you have a big backside, and that's just your genetics. You're that type of person. Some people have a sway back curve. Some people get told they have too flat a neck or too curved a neck. Does it cause a problem? That's what I always settle on, because if you have a very curved back, but you feel fine, you don't have any issues, and I wouldn't tell you to change it. Now, if you have a very curved back and you have back pain or hip pain or knee pain, then I start digging and I'm like, okay, maybe there's a muscle imbalance here that's contributing to your very curved back. And I have to dig deeper. And usually what I see there is people are overusing their back muscles. Their back muscles are, let me show you over here. They're right here in the small of their back. And these muscles will overwork if glutes are too weak. Also, if abdominals, lower abdominals are too weak. Because when your lower abdominals can't activate very well and your glutes can't activate very well, it sends your pelvis into an anterior tilt. I'll show you again. So these two muscle groups, lower abs and glutes, weak. It makes your body want to do this. Abs let go, so this gets longer down here. Glutes let go, so you stop doing hip extension, you start doing hip flexion. And then in order to stand upright, your back has to curve so that you're upright up here rather than leaning forward. And that can set people up to where they have too big of a curve in their back, but we have to dig deeper and see, is it you? Is it just your genetics and that's okay? Or is there a problem that we need to fix? Good question, Julie. Stephanie says, I'm a little afraid to turn my foot like that doing the clamshell. Is that okay for the tear in the meniscus? Because one false move and I'm having big problems for days. Yeah, I have people with meniscus tears do it all the time. Now, if you're worried and concerned about it, then what I would recommend is just turn it a little bit and see how you do, and check to see if you can even just activate your glutes without having to turn your foot. And if you're still concerned, if you're not comfortable with trying it out, then I'd be okay with you skipping clams and going to butt burners or other exercises that I'll cover here in a minute. That might work for you. As just make sure that you're following the rules. You need to activate your glutes. These are black and white rules. Like, you have to do them. There's no bending on these rules. You will fail in healing your knee arthritis naturally and avoiding a knee replacement surgery if you do not follow these rules. If you're trying to do these advanced exercises, if you're trying to do Robert's exercise, the hip thruster exercise, and you failed these rules, you're setting yourself up to feed the imbalance. So that is a hard and fast situation. You need to follow the rules of the glutes in order to progress through exercises. As long as you're doing that, then you can skip the foot out on the clam. That's fine. And chances are, as you get stronger in other exercises, you'll probably feel more confident to turn your foot out without hurting your knee. All right, Dr. Lyons has a question. Is arthrosis a progression/deterioration of arthritis? That's the way I understand it. Arthritis is more acute inflammation, and arthrosis is more like a chronic degeneration. Hair splitting, in my opinion. I see MRIs with this information is arthrosis versus arthritis. Same thing with like tendinitis versus tendinosis. I think it's truly just hair. It's like saying, well, this is I don't know shades of colors. What are blues? What kind of blue is this? Like teal versus navy blue versus this shade of blue versus that shade of blue. Like, some people are very attuned to telling the differences, and it matters definitely for art and design and all that. But if you just want a blue and it's this shade versus that shade, it's not really going to make a difference. And the treatment, because if we're talking about a diagnosis and you're diagnosing between arthrosis and arthritis, it's not going to change treatment. So why debate it? We can talk and talk and talk, and we're just talking about things that aren't really going to influence the long-term plan here. Now, some doctors will be like, well, we'd recommend this injection or that injection, but it's missing the point. We're not fixing the muscle imbalance. And if we fix the muscle imbalance, we clean up arthritis and arthrosis. Same treatment fixes both problems. So why debate, is it arthrosis or arthritis? Just fix the root problem and you'll be good, Dr. Lyons. All right, we have a call on wait. We're going to be talking to Barbara in North Carolina, and she's got a glutes problem. So come over here. Hey, Barbara, this is Dr. David. Are you with me?
Yes, I am. Thank you so much for taking my call.
Absolutely. Glad to meet you, Barbara. I hear you have a glute issue. Can you share more, and maybe I can help you out?
Yes, I had it's been for 8 months actually. I was just, I guess, misdiagnosed as just a simple lumbar spondylosis. And my next situation was a few months later. The pain was really excruciating. It was in the right groin and the right bursa and the back hip. And so I went to a different ortho who took an MRI.
Yeah.
And so we have a confirmed gluteus minimus tear with osteoarthritis, he thinks underlying labral tears.
Okay.
And so at this point, he has ordered an offloading brace, an Icarius brace, which I was going to be fitted for. But in the meantime, doctor, I have through your beautiful exercises a few months ago, just the glute tightening and the mini clams and the mini bridges, I have improved to the point where I now went from a 15-minute walk, but you said no more walking, to a 30-minute walk. But I'm hearing you say not to walk. Because until I get so I'll be using a cane until I get my brace.
Okay.
I don't take any pain meds. Rarely I'll take an NSAID, but it's rare. But I don't depend on any of that, and I just constantly tightening my glutes and all that because you have made it stuck in my head. So whatever I can do to keep those glutes active. You are an amazing doctor. I want to thank you. I think
thank you.
Thank you. You're the only person I listen to at this point. I've told my chiropractor that you're such an amazing person, that you have helped me more than anybody.
Well, I'm happy to help. I'm glad this is working for you and you're getting some improvements. That's why I do this. I just care that you guys are out there getting the best treatment possible and avoiding unnecessary surgeries for sure. Well, it sounds like that's good that the glute activation has worked for you. And regarding the tear, one of the reasons that I think that the tears get diagnosed on the MRI, and it can be confusing because you might think, wait, Dr. David's saying to activate the glutes, yet I have a glute tear on my MRI. And what you have to realize is, I have the skeleton here, I do, is some of the glute muscles are involved in hip flexion and hip abduction, moving your leg outwards to the side. And those two motions are motions that are mainly done by the quads and the TFL, muscles that feed into the imbalance and make the imbalance worse and set up the labral tear and arthritis in the hip joint. And so because, especially like the gluteus medius, the front half of it attaches, let me show on the skeleton here. To the greater trochanter. So on the distal attachment, the attachment that's farther away, it attaches to the greater trochanter. All the glutes attach to this bone right here. You can see on the live stream. You have glute maximus more so on the back side and kind of lower, glute medius on the top, and then glute minimus in the front. Well, glute medius, the back half of glute medius helps with hip extension. The front half of gluteus medius helps with hip flexion. Both halves mainly do this motion right here. So we have to kind of hair split a bit here because it matters. Because if you're imbalanced, we're using more muscles more on the front of the hip in an inappropriate way, this isn't the imbalance, then potentially you got a tear of the muscle, the part of the glute muscles that feed into the imbalance. And that makes sense to me as to why you might be using your glutes and actually improving despite having a gluteal tear, as the MRI shows. So I just want to clear that up for you because it sounds confounding. It sounds like what's the word? Like it contradicts itself, but it's actually in line. And so if you're the best judge of this, because if you feel pain when you're using your glute muscles, then we want to avoid that. And it might be right to be on crutches or a cane or a walker right now. That sounds like the brace is going to be a good option for you as well. And we need to wait for that to heal. But then as you get stronger, as you heal more, then it's time to get stronger, and you actually do need to use those glutes.
And I feel it more in my groin, right groin.
Yep. Yeah, that's because you're likely, the way the imbalance happens, the way that you're imbalanced very likely is you're using the hip flexors more, the front half of the glute muscles, which help with hip flexion. TFL helps with hip flexion as well, tensor fasciae lata. And so when you're more strong, more dominant in the muscles on the front of the hip, it pulls the ball, go this way, of the hip joint. See, the ball should sit in the middle of the socket here, But if you're stronger on the muscles in the front and weaker on the muscles in the back, the glute maximus, the main glute muscles, then the ball kind of drifts forward a bit in the joint. It's not dislocated, it's just not congruent in the middle of the joint because there's improper balance. And so it starts to pinch the front of the joint. And that's why you'll feel that discomfort right in the front, like where your leg meets your body. And that's why you get a labral tear right there. That's where the labrum is. It's right there. And so people get tears there as a result. And by fixing the glute strength and becoming more glute dominant, then you'll center the ball in the socket and get it off that front edge of the socket. Does that make sense, Barbara?
Yes, it does. And I guess I also do aqua aerobics, but I realize, like you said, not to do the lateral movement.
Yeah, I advise against it. I mean, here and there, it's okay. Well, the main thing is I would love for you to finish an aqua aerobics class and say, golly, I feel it in the back of my glutes, on the back of my hip. That muscle is most tired, more than any other muscle in my legs, especially in my hips. If you leave the aerobics class, the water aerobics class, saying that honestly, then it was a good class for you and it's productive. But if you leave the class and you're saying, it's more the front of my hips, more the side of my hips, completely miss the glutes, then it's not a good exercise for you. It's not a good workout for you to go to.
Right. Would this also cause knee stiffness? I have had both knees replaced and both shoulders replaced, by the way.
Okay. Yes, absolutely. Because it's the same muscle imbalance in the hip, weak glutes, that will cause the quad muscles in the front. Some of those are hip flexors too. One of those is a hip flexor, and it'll increase the pressures at the knee joints. And so this sets up knee arthritis, knee stiffness. That might be what led to the knee replacement in your case. And you, even though you have the knees replaced, it's prudent of you to fix this imbalance so that you aren't putting extra pressures on your replaced knee and speeding up the how long your knee's going to last. So ideally, you don't want to have a second knee replacement. You want this to be the last knee replacement you ever had in that knee, in either knee, and then have to go back for a revision because something got loose or something got worn down in there, and so we don't want to have another surgery.
Right. And these are years old. So I'm 77 now. I'm only 106 pounds. So weight is not an issue here.
Yeah.
Muscle mass.
Yep. Which that's a nice thing. That's one less thing to compete with. A lot of people have weight issues to deal with, but I still tell people you can be a little overweight and still fix these imbalances without having to lose a weight. But that's not anything you're worried about. Yeah, your weight's excellent. It's just getting stronger in your case, Barbara.
I just can't get over how wonderful your program is. Would you advise all of today? And plus, is there a particular program you have that would address these other problems I discussed?
Yes, absolutely. So for the knee issues, it would be the knee arthritis recovery program. And I know you had the knee replacements, but the same principles apply. We do also have a failed knee replacement program. If you feel like it's more the knees that bother you for the knee replacements, and that might be the better program. And then we have a hip arthritis recovery program that might be best for the hip issues. That sounds like that one's probably where you need to go. And before signing up and joining the membership, I would recommend going to our website and trying out phase 1 for free. There's plenty of stuff for you to do there. And that way you can begin to see if it's right for you before you sign up and work with us.
Did you have one for also the bursa, the right bursa exercises?
It would be the same program because it's the same muscle imbalance that the one that I've talked to you about with the weak glutes that sets up bursitis in the hip, tendinitis and torn tendons in the hip. It's the same exact muscle imbalance, and it sets up hip arthritis and knee arthritis actually. So a lot of people that have hip arthritis primarily also have knee arthritis, and we tell them go to our hip arthritis program if that's your main concern. You're also going to get benefit though for your knee arthritis problem because the program will help. So well,
the main thing is to avoid surgery because the doctor at first wanted to go and repair the gluteus medius tear, and a month later stepped back. Said, "Well, my function over MRI, which I think you stressed, is what we should go by, and my functionality improved." So we're going to step back from surgery, and I like to step back permanently from surgery.
Yeah. Keep getting stronger in those glutes. I think that's the solution for you.
Okay. Oh my goodness. Thank you so much for your time.
Absolutely, Doctor. Barbara. Thanks for calling. Wish you the best of luck.
Thank you so much. And I will be seeing you, I'm sure, again and again and again.
We'll be here. Thank you, Barbara. Bye-bye.
Thank you. Bye-bye.
Great talk from Barbara. Thank you so much for calling in, Barbara, and sharing your story with us for everybody's benefit so we can all learn. So we're going back over here, guys. Great, fantastic. Let's keep going on our lesson here. So we were on the beginner side of the glute exercise spectrum. We have glute activation, number 1. Number 2 is standing up from the chair. Number 3 is just standing and activating your glutes. Number 4 was doing the clamshells, holding for 10 seconds. Also with the standing, that's holding. Butt burners, I showed you that one on all fours. That one's also holding. And the reason for the holding is to get that nerve to muscle connection to increase so that it can help with your conscious glute activation and allow you to better use the glutes and not take over with other muscles. Once you've been practicing that this is essentially what we practice in phase 1 and some of phase 2 of our programs, because we have phases. We have the phases charts. Yeah. Here's the chart that has all the phases of the program. Let me stand on this side of it. So phase 1 is when it's really bad, and we have criteria. If you go to our free phase 1 of the knee arthritis recovery program on our website, you can take a quiz actually where you can determine which phase you're in. And most people starting on our program, they're in phase 1, possibly phase 2. But if you're there, you should be doing this kind of stuff. And the videos that are available for free to you cover some of these exercises so that you can know what to do. All right, once you've got good glute activation, then we head over to number 6. Oh, actually, I was going to do it in purple. Trying to use different colors here for you guys. Number 6. Now we're in standing. And these are kickbacks. All right, so this is similar to the one that I was doing on all fours a moment ago. I'm going to use this walker just for balance. You don't have to do this exercise with the walker. You just need something sturdy. It could be even a wall, a piece of furniture. If you're in a gym setting, one of the frames for the squat racks or something like that. But what you're going to be doing here is kicking back your leg like so. So I'm moving my foot backwards right here. But with the intent, I am very consciously thinking about tightening this muscle as I move my leg back. So you go forward and back. And what I recommend doing here is the 10-second hold. This is a great exercise to do a 10-second hold. And you're using your other glute too, let me show you the backside, to balance. Because once you stand up on one leg, your body wants to do this. But if you keep your hips level, this glute has to activate. Then you're holding this side with the foot back to get this glute to activate. 10-second holds do wonders to get that neuromotor connection. And then a little pro tip here is if you just angle your knee out and turn the toe out, you get an even better burn on that glute so you can get it to firm up and begin to get conscious control. So I like to tell people to do 10-second holds 10 times on one side. You can alternate sides, go back and forth, whatever works for you, but do the other side as well. Even though you have knee arthritis on just one side potentially, I would work both sides. Because chances are you have the imbalance on both sides. It just happens to be that your right knee got affected or your left knee got affected first. So that's a standing glute kickbacks. Now, one thing I want to highlight is this exercise is commonly given by physical therapists and trainers and doctors for people with hip arthritis or knee arthritis. But they'll tell you, just go back and do reps like this, and there's no education on using the right muscle. It's just do the movements. And it's possible to use the hamstring primarily to do the movements. I need you to think about using this one and tighten it and activate it and feel it working, and ideally even hold here for 10 seconds. Do the little pro tip, knee out, toe out. Just make sure not to rotate your whole body when you do that. You just want to keep your body stable up here. As you come back, then only the leg and the toe comes out. Hold it for 10 seconds. And then the other thing they'll tell you to do is go forward, go across your body this way, and go to the side. I'm not a fan of the forward ones or the sides ones, outside or inside. I only want you to go back because we are focused on getting the glutes to get stronger. And if you're spending time going forward and to the sides, we're taking away from that focus. We want to avoid a knee replacement. We need to focus 1000% on the glutes. All right, next one here. Number 7. Mini squats. Now we're getting into some squats. I love this one. This is one of my favorite ones. We covered this at the beginning of phase 2 in the program, and definitely in phase 3, we get a little more advanced in it. So the idea here is you have conscious control of your glutes. So in standing, you start with standing, you can tighten your glutes. Remember, this was number 3 on my drawing there, that you can just tighten your glutes in standing, which drives your hips forward. So it tucks your bottom, your butt, under your spine to stack you vertically, because we are bipedal. We need to be stacking everything vertically. That's efficient for our bodies as humans. So when we stack vertically, then we're activating the glutes. I'm just pulling my shirt tight here so you can see my body contours and see what I'm doing here. Then I'm going to bend my knees and I'm just going to unlock my knees. What I mean by that is if your knees are straight, you're using your quads to hold your knees straight. So we want to take the quads out of it and just bend the knees a little. When I say squats, when I tell somebody with knee arthritis that they're going to be doing a squat, they look afraid and worried and scared. But we're not talking full-on depth squats where your bottom's touching your heels. I'm just talking about barely unlocking the knees, and this is a mini squat. That's it. So now from the front side, what I want you to see is I'm standing right here, hips forward because my glutes tightened up on both sides here, and then I unlock my knees. And what I want you to see next here is do not allow your knees to go in like this. If they go in, you're going to be using your quads more. You can play with it and see. When your knees come in, quads activate. You actually need to shove your knees out because that takes your quads out of it as long as your hips are forward, and it makes your glutes in the backside activate better. Then you're doing a 10-second hold. You count to 10 real slow. After 5, then you go another 5. You get to 10. After 10, then you can come up. And the point of this exercise is to train your legs, your hips and knees and feet and your core to make your glutes be the primary muscle being used when you dip down a bit. If you can do that and you've gotten good glute activation, you're not taking over the other muscles, and you can make your glutes activate when you just dip down a bit, what eventually happens to people doing this exercise is they start to tolerate going a bit lower and a bit lower in their squat. And I never tell people you have to go full depth squat all the way down in order to fix knee arthritis. In fact, the opposite happens. We have people that just stick to the mini squat. They're just dropping an inch or two, and they clear up their knee pain. And they feel great walking, and they feel good to not have knee surgery and make sure they can get back to doing all the things they love to do without worrying about their knee getting worse, simply by doing a little mini squat. This might be where some people max out. And if you don't have any higher intensity activities to do, you can probably stop here for a lot of people. This is true. We have people do this all the time in our knee arthritis recovery program. The main thing is that you activate the glutes, just like I said, according to the rules. If you're not activating your glutes in the mini squat throughout the 10-second hold, you are compensating and you're going to cause more knee pressure. That's not good. So you need to make sure that you follow it just like I showed you. Rewind the video and check it if you need to. All right, we have another call here. We're going to be talking to Eve in San Diego. Let's see what Eve has to say. Hi, Eve. This is Dr. David. Are you there?
Yes, I'm here. I'm so excited to talk to you too.
Oh, it's nice to talk to you. I hear you have a hip and a back problem. I'm happy to help. Tell me more.
Yeah, so I started watching you a while back because
the physical therapists just weren't getting it. And like the minute you said muscle imbalance, I just knew exactly that's what it was, because at the age of 14, I had a Harrington rod fusion for my severe scoliosis. So, I mean, I've done great with it up to now. Like now I'm just turned 63 last week. So
happy birthday.
Oh, thank you. So all of a sudden I started having like groin pain issues and stuff like that, and like lower back that just wasn't clearing up. And they did an MRI and said that I have a torn labrum and osteoarthritis, and that my L1, L4, L5, and S1 are like moving, you know, and so all of that together kind of caused like my SI joint not to be like hurt all the time, and then And then I feel like what started this is that I, like 4 years ago, like I had like knee issues, and then they told me that I had a calcified meniscus. So I kind of 4 or 5 years ago, I stopped doing the cross training because it freaked me out so bad when I hurt my knee and I couldn't walk for so long that I think I just went too lax, you know, because I didn't want to re-hurt it. And I stopped doing all those things that maintained more of my glute strength and stuff, right? So now I'm in this situation right now where I'm trying to get better, but it seems like, I don't know if it's just too much happening at the same time that I feel like I can't advance to your next levels.
Yeah. I hear you, Eve. I'm so sorry.
So that's my long story short. But I appreciate you so much, because what you have given me, like, it got to the point where I was like arguing with the therapist. You know what I mean? So I'm like, okay, I just have to stop going to them and just kind of do your stuff. But I can do the glutes and stuff and activate them. Like I can do some abs, but obviously with my fusion going down to L3, I can't really do a lot of that. Like, you know, when you like, whenever you show videos, like, okay, once we're past this point, we're going to start doing this. I can't go to that. You know?
I understand. You can still get better. You can still definitely make progress. You might just go slower, especially with the ab stuff. And your core having, you know, having the rods in there for the scoliosis, you're just going to have to work more so on isometrics, meaning instead of doing a full-on sit-up, just holding your abs in will work. Now, I let me tell you this quick story. I'm in El Paso, Texas. You look at the map, you can see where it is. I used to go to school in Austin when I was in college. And so whenever I had to drive back home, I had to do this excruciating 8.5-hour drive across desert of the West Texas desert. And it was so boring. And all I would see are mile markers passing every so often as I was driving down the highway, and I would get bored. And this is before, you know, I didn't have an iPhone back then. So it was audiobooks on my CD player. And so I was really bored. Anyways, I was learning this ab stuff, and I started just playing a game with myself where I would hold my abs in. I'm driving, so I can't do a sit up. I can't really move. I'm just have to, you know, have my hand on the wheel and pay attention, so I'm safe. And I'm just sucking in my abs for as many mile markers as I could. And the highest I ever got was about 8 to 10 mile markers. And then I would I'd just give up, and my abs will let go. And I would do this for hours. Most of my drive, you know, 6+ hours, I was doing this. The next day, Eve, having never done one sit-up, I was just tightening up my abs. I felt like I did 1,000 crunches. I couldn't cough. I couldn't sneeze without pain. It was just, and it wasn't, you know, I overdid it, obviously. But what I'm saying is, if you hold an ab contraction, if you just get conscious control over your lower abdominals, and you just hold it without having to do sit-ups, that might be what you need to focus on. You can absolutely get stronger and set yourself up to fix these problems. It just might take you a little bit longer. Your path might be slightly different, but you can do this.
No, and I do that. Like I follow your 10-second hold or even longer all the time, and I totally understand that principle. But I guess since like and I got the cane, I finally went, okay, I need to do this because I don't take meds, you know, and I purposely know that if my body starts to say you're tired, I stop, right? And that's why I don't take meds, because that's the only way to control that, right? And I'm pretty strong, but like the hip flexor thing, like, the back side, when it comes up the back, on your back, on your lower back, and it attaches to your rib cage, that area right there is one of my most, high pain areas. And it's just because of the hip flexor, right?
Mm-hmm.
So when I'm doing my ab activation, I could just go a little bit too far, and then that triggers it. Once that area gets triggered, I have the shooting pain all the way down to my foot.
Yeah.
And it's not so much the actual hip or the actual spine that hurt, it's everything that triggers because of them.
Got it.
Do you know what I mean?
Yes.
So I'm like always trying to be like super careful. Like there's like, my range of motion is limited, but within that range of motion, I still have so many little triggers, you know? That's why one of my questions that you read was like, I wonder if I just need like a custom program from you, because I just feel like there's so many parameters that I'm working with.
Gotcha. Yep. In our programs, I think you'd be great in the hip arthritis recovery program. If you were to join, this is just in case you guys don't know how this works. We have the education part, obviously, which we even have a test people have to pass. Once you pass that test, though, which people can finish in a day or two once you join the program, if you hustle at it, most people will take a week. You then qualify for breakthrough sessions. A breakthrough session is a visit with one of our recovery coaches, and that is where your hip arthritis recovery program, we have the same setup in the knee arthritis recovery program. That is where you get your plan customized. And then depending on how you sign up with us, there's tiers to our program where you actually can consult with a specialist physical therapist. We have a physical therapist in-house who will talk to you over Zoom so that you can get tweaks made to your plan so that it's not just generic. You can definitely follow the plan generically, and that works for probably more than half of the people in the program. But there's a good chunk, like a 30 to 40%, which you'd fall into, Eve, that you just need to be touching base with our coaches, and you have access to them in our program, and you can make tweaks to make sure that it's individualized to you. So okay, this part of the program doesn't apply to me, or this part of the program, I need to do it, but a little bit different so that it fits my situation. We have that help. Are you there, Eve?
I think I lost.
Oh, I'm here. I hear you.
There you go.
Great.
Yeah. Like what you did right now with doing the kickbacks on the cane, standing kickbacks.
Yes.
Like that, I was like, oh, that's good, because I know that if I do it on all fours, I already know my back. Like that's too much pressure on my lower back. Like stuff like that, just changing it up.
Yeah.
And then also, what was I going to say is that there's still that knee meniscus that's calcified. You know what I mean? So I also have to be careful that I don't overdo that. And is there anything for that? Like once it's calcified, I don't know if you ever mentioned that. I always wonder about my knee. Like once it's calcified, is it like done?
No. People get parts of their body that are calcified all the time, and they get into their 70s, 80s, and beyond, and don't even know it, Eve, until they get an MRI or an X-ray, and then the doctor says, hey, your rotator cuff shows calcification, or your hip labrum shows, your meniscus shows calcification, and there's people that are like, oh, I didn't even know. It's almost like a part of aging, and sure, it can be sped up with injuries, but the mechanics of the tissue, of your meniscus in this case, it might still function just fine, even though there's calcification that shows up on the imaging. Imaging has done wonderful things for the healthcare field. Don't get me wrong, but it also has caused us in the medical field to find problems when there possibly isn't a problem. Just think of it this way. If you drove a 1957 Chevy car, I don't know what they're called, Chevelle or something, and it still runs, it can get you to work, to the grocery store, to all the things you have to do, whatever it is, but there's a rusted hole on the side of the door. It looks ugly, right? But it still works, and it'll still serve you just fine.
Yeah.
That's the idea with when you see calcification like that, unless there's a clear obstruction to the mechanics of the joints, I wouldn't touch it. I'd work on fixing the muscle imbalances so that we can further improve the mechanics and get the pain away.
Okay. Because sometimes it'll like speak to me and make me like, oh, hello?
I'm here.
Sorry.
Fine.
Sometimes it'll it'll like start to flare up. So I like calm it down. But for the most part, like even like my knee doctor goes, yeah, I don't even know how you just keep going, and that you're so good with your calcium, your meniscus the way it is. So that's like the recipe car that you're talking about. So
yes.
That makes sense to me.
Yeah.
Yeah. So
when it rains, you might park in the shade.
My knee. Yeah, exactly. Yeah, when it rains, I might park in the shade. Yeah, that's a good idea. That's a perfect analogy. Okay, I like that.
Mm-hmm.
Okay, so then, I'll just reach out to you guys then, I guess.
Okay.
And I'm so excited to talk to you. You've like helped me so much just by like the glute, you know, just everything you do and your videos. And I appreciate it so much, like everybody else probably here on this call. So,
absolutely. I'm happy to help you.
So thank you so much.
Yeah, no problem. Stay on the line so we can make sure to get you help.
Progress,
yes.
You know?
Yes, absolutely. Please stay on the line. I'm going to pass you over to our help here. And I just want to make sure that you have the right help. Okay.
Okay. Thank you so much.
Thank you too. Bye-bye.
Have a blessed day.
Thank you as well. Awesome call from Eve. She was one that popped up in the comments. I remember you, Eve, on the comments. And so I'm so glad that you got to call and got through and that we got to talk to you. And hopefully you got some customization to your exercise plan. And I hope that you can work with us and get all the customization that you need. So what questions do you guys have in the comments? So let's take a look and see what we can answer here. We have Stephanie. Can I start the arthritis program when I'm having a meniscus tear? Yes, we have had people who do not yet have arthritis, but have a meniscus tear, because the meniscus tear is the beginning of arthritis, in my opinion. It's just they've separated it, and doctors like to treat them differently, but it's the same problem, root problem that sets it up. So we do have people that are on the younger side, if you will. You know, you guys might be in your 40s or maybe even your 30s and have a meniscus tear. And they're in our arthritis program, and they do well. We have to talk to you, make sure that you're a good fit, that you're safe for our program. We do this to everybody in the program, not just because you don't have arthritis and just a meniscus tear, but you would absolutely benefit. And we do have a separate knee meniscus tear recovery program that you could go with. However, that program does not offer all the same support that our knee arthritis program does. Our knee arthritis program comes with all the stuff that I talked about with Eve a second ago. We have coaches that work with you. We have tests in that program. There's a private community as well where you can post a question and get answers, usually the same day, within hours or minutes even. And then we also have access to a specialist physical therapist that you can consult with over Zoom. All this is over Zoom. We do have the option to come in person if that's something you want to do. Some people like to do that, and we have people in here all the time from all over the country. So we love to help you guys out whenever you're here. So hope that answers your question. Huda says, do you have a program for both hip and lower back arthritis? Great question. We have a back pain program. Doesn't have all the same stuff as our hip program. It's like the meniscus program that I was just saying. It's just a standalone program. However, our hip arthritis recovery program is designed to also deal with back issues. And we have people in there all the time. Sometimes on our weekly group coaching calls, I didn't even mention that. We have weekly group coaching calls that myself and my coaches lead, and we're answering questions for an hour, and we're doing a little bit of teaching. It's all private on Zoom, so it's not open to the public. You have to be a member of our program. But sometimes the conversation goes to mostly sciatica or stenosis or disc issues, because a lot of people who have hip arthritis also have back pain. And I recognize that. It's because of the same muscle imbalances. So we will discuss it, and people get a lot of value. We see it in the comments and in the private community of people dealing with hip arthritis plus sciatica, hip arthritis plus some other back issue, herniations or stenosis, arthritis in the spine as well, arthrosis or degenerative disc disease in the spine too. So my recommendation is to look at our hip arthritis recovery program, see if that's right for you. We have it for free, the phase 1 for free. And you can also look at our back pain recovery program and see if maybe that's better for you as well. Aaron says, I just started the hip arthritis program on Thursday and Friday and Saturday. I did 10-second glute tightening, 10-second foot curls, and very sore. It's a bit of a learning curve at the beginning. And yeah, if you hit it too hard, you got to be careful with that, Aaron. Make sure that you moderate it so that you're not too sore. I'm okay with you being sore, by the way. I love when people tell me they're sore because they exercised and they're sore in the muscles, not in the joints, not in their hips or knees or ankles or feet, like the toes. it's truly the muscles, then that is a good thing for you. If you are too sore, then just back off on how much exercise you're doing. You'll ramp it up as time goes on. So you're on the right path. Just be careful not to overdo it. Cindy says, I'm watching and trying to stand from sitting position. Oh, that exercise. This is hard. Yeah. And I bet, Cindy, let me read the rest because I want to say something. I recently noticed I cannot even put my knees together anymore. Issue is hip away in both hips. Yeah. It's hard usually because people just can't think of how to fire their muscles. It's not that it's too hard, like it's not physically possible for you to stand up. I bet you sit and stand all day without even thinking about it. But when you have to stop and think and apply the rules, now it becomes hard, and it's more hard up here, hard on how you think about doing this rather than physically hard. But that's what's necessary, Cindy, to fix this problem. So I'm glad that you're sharing your struggle. That's exactly where you need to be. Good job, Cindy. Our fellow Texan in Odessa, Ellen says, is it possible for someone with a meniscus root tear to avoid meniscus repair surgery if one diligently does the exercises you recommended in your knee arthritis program? That's a good question. I can't say that I've had somebody go through our program with a meniscus root tear. That is a kind of a more severe meniscus injury. They're not as common. They happen, but they're not as common as just like your typical tear that you hear about. So I can't say with certainty. My best recommendation, Ellen, is give it a shot. Try our program and let us know. I mean, what have you got to lose? And the program's designed for you to not hurt more, so you'll know when you need to back off. So really, we need people to test it. We need people like you to give it a shot and see if it works for you. I think it will. That's my educated guess as an expert in avoiding surgery. But I don't have a clear case that I can say with honesty that it will work. So that's my best answer for you, Ellen. I hope to see you in our program. Hopefully it helps you out. I think it'll work. I really do. Leo says, hello, Dr. David. I have a meniscus tear. Do you recommend to have meniscus surgery if I want to continue playing sports? No. Doctors love to say that. Physical therapists love to say, oh, you're not going to be able to play sports unless you have surgery. Leo, did you know there's studies coming out of Europe, Netherlands, I believe. I'll have to double check that. But where they have connected that people that have a meniscectomy procedure, the most commonly done meniscus surgery, end up getting osteoarthritis in their knee way faster than people that never get operated on but have a tear. This is facts here. This is evidence-based research studies that I'm talking about. You're more likely to have arthritis and get worse if you have meniscus surgery. Now, sure, you can split hairs on, well, this surgeon's better than that surgeon, this procedure is better than that procedure, this type of tear does better than that type of tear. But the fact is, if they're doing a meniscectomy, they're taking a chunk out of your meniscus, which means you have less cartilage in your knee now. Even if the meniscus is torn, I think it's beneficial for you to have that cartilage there. We assume the surgery fixes everything, but it does not fix the muscle imbalance. And if you fix the muscle imbalance, you depressurize that knee joint and probably allow the meniscus tear to heal. And if it's not going to heal, at least you don't make it any worse. We have people all the time who go through our programs with meniscus tears, even just comment on our videos and let us know that they've gotten better, even though they have a meniscus tear, never had surgery, and they've just done glute exercises. And you can even go back to sports. I've never had imaging done, but I'm pretty certain I have a meniscus tear myself. I've helped tons of patients who have had meniscus tears get back to running, jumping activities, but it comes back to this spectrum here. We have to start on, can you activate your glutes? Can you stand up and activate your glutes? You know, from sitting, stand up. Can you just be standing and activate? Can you go through all this progression and use your glutes properly? Because what I said earlier applies to meniscus. What I said about the arthritis, you can't avoid a knee replacement surgery unless you figure out how to activate your glutes. I'd say it's the exact same thing with a meniscus surgery. You can't avoid getting back to being very active again unless you first figure out how to activate your glutes. So that's my answer for you, Leo. I do not recommend the surgery. I think you have an excellent chance, unless you have a lot of locking in your knee. If your knee joint is locking, you know what if you've had locking. If it's locking like every hour, several times a day, and it's not getting any better despite doing glute exercises, then I would say, please go have surgery. There's something seriously wrong with the mechanics of your knee. If it's locking, you can't even walk. It's not functional for you. Go have surgery. But if you're walking, it just hurts. But you can bend your knee. You're not locking your knee joint, and you can walk all you want for the most part. Of course, it might hurt. Then I think you have an excellent chance at avoiding a surgery, a meniscus surgery, and getting back to being active again, including sports. You just have to fix the imbalance. Linda says, how about seated abductor for glutes and hip thrusts? Getting on my knees aggravated my hip socket, but can use those machines and booty builder machine. I am happy for you to use all those machines. With the seated abductor, let me show you what I mean, what that exercise looks like. We're talking about the machine where you sit, and it's got some pads that go on the outside of your knees, and then you open your legs against the pads, and there's usually a stack of plates, and you change the resistance, and you're doing this motion where you're opening your legs. It is possible for you to miss using the back of your glutes and use the side or front of your glutes, the gluteus minimus and the front part of the glute medius, and you're not using the right glutes anymore. You need to feel it in the back. And if you cannot make the back of the glute work when you're doing the abductor machine, then it's a no-go for you. You should not be using it. You can play with the position. Usually if you lean forward a bit more, that might make the glutes work a bit. But if the weight's too much, you might also compensate. I think that one's a little dangerous where you get co-contraction. You get other muscles to work along with the glutes, and it just isn't ideal. So I would much rather you find the right exercises, that booty builder machine, maybe the hip thruster machine that makes you focus on the backside of your glutes. I would work on that. The key take-home message is, can you do those exercises and follow rule number 1 and rule number 2? If you're using other muscles that are not the back of your hip, the butt muscle, it's not right. You're feeding the imbalance. Good question, Linda. All right, we have another comment here, 2 parts. Stephanie says, can I do exercises on my knees with the tear on all fours? I'm afraid it will get worse. And then she says, can I also do standing exercises when I have a meniscus tear? It's a matter of trying it out. Some people tolerate being on their knees just fine. If you are, the thing is, in the knee joint, do I have my knee model here? Yeah. Let me show you the mechanics of this. So there's the meniscus right there. How do I do this? Cover my hand. There's the meniscus right there. That thing that I'm wiggling, and it has the ability to wiggle whenever you bend your knee, because the point of the meniscus is it should move kind of with your thigh bone to keep the knee joint stable. So here's the kneecap, and then that's meniscus right here, that bluish, light blue thing right there that I'm touching. If you bend the knee and kneel, you're putting the meniscus in a position where it has to move, and that's okay. It's supposed to do that. However, if your meniscus is very sensitive, delicate right now because it's just not, it's not healed enough, it might shift the meniscus a little much and cause it to pinch or become uncomfortable. Not everybody has this problem though. So you might have that problem, which means you might need to go to standing exercises, but you can still work out your glutes. You might need to do the clams more, and you might not be able to do the butt burners. There's still things you can do. You can skip an exercise as long as you follow the rules and you're able to activate your glutes, like in a mini squat. It's okay to not kneel. It's just some people feel the butt burners very well, and that's a good exercise for them. But if it bothers you, then don't worry about it. You can do the standing exercises. That should work just fine. Hope that helps you out there, Stephanie. Linda says, a top surgeon wants to take both my hips 2 weeks apart. Thoughts? Only my left is bone on bone in front, and right has reduced space, but not touching. I can hear clicking though on both sides. Use crutches. Yeah. I don't know. It depends on your situation, Linda. It could be that a hip joint replacement is necessary on both sides. It could be that you're better. Here's the thing that I say though to help you. if you have good motion in your hips, despite the pain and despite the x-rays and them showing bone on bone. But let me show you what I mean by this. If you sit down, Linda, and this goes for everybody, and this is for knees too. If you sit down and you bring your knee up towards your chest and your hip can bend like this, you can get your knee towards your chest and your knee can bend a decent amount. The rule that I use is about 80% of the motion available compared to your good side. So in other words, if my good side comes up all the way right here, and this is about 80% compared to the other side, then that's good. That means that the mechanics, the way the joint bends and moves in the knee and in the hip, the mechanics are actually good. It might be painful. You might be like, oh, it's painful. That just means that it's irritated inside. And that end range motion irritates it a bit more in the hip or the knee. But the mechanics, as far as the shape of the joint, the cartilage shape, all the stuff that's inside the joint is there and ready to work for you if you can get it to calm down. And it might just be that you're so irritated right now and you're telling the doctor this, and the doctor's trying to do a good job. They're trying to help you with what they know to help you, which is surgery in this case. And if they see the evidence on the x-ray that, oh, it's bone on bone, this is a prime candidate to do a surgery on, then they're going to offer the help as they should. That's their training. But I'm giving you some information here to help you think this through. If you have good motion, despite the pain, then that tells me and you that you have good mechanics. And if you get that joint offloaded with a walker like this, you might get the pain to calm down, and then you begin to fix the muscle imbalance using the glute exercises like I've been talking about. Then you might fix the mechanics even more, and you can tolerate more. The thing is, what we're faced up against now is, what is your tolerance, Linda? Are you ready to pull the trigger on this? Do you have capacity to do this kind of a fix, this long-term fix? Because it's exercise, it's dedication, and I'm asking for hourly stuff here. You have to decide if that's right for you. You might be a great person to do this. You might be like, oh, I love exercise. I'm all for this. Or you might be like, I'm done. I'm done waiting on this hip. I've tried things, and I know you're telling me this, Dr. David, but I'm kind of, that's fine. It's your hips. You got to decide what you want to do, though. This goes for everybody, of course. I'm not just telling you. So, Linda, my heart goes out to you. That's tough. I hope that you get better, no matter what the outcome is, whether you have a surgery or not. I'm not going to judge you either way. You got to do what you got to do. Everybody out there's got to do what they got to do. I'm just here to give you some information, because surgery isn't always the only way. And sometimes it's right for you to say no to the doctor, wait, give this a shot, do it well, appropriately and properly apply this program. And you might actually do just fine without surgery, but you got to determine that. Great. All right, let's get back into this lesson here and finish off this list. Let me just get a swig of water. Getting chunks of ice. All right, we're on purple. So we covered glute activation, absolute most important thing to start with. Then just being able to stand up from a chair using your glutes, key. You have to think about using your glutes all the time. Then just standing up and activating your glutes, very, very important for your everyday activities. Then we actually got into an exercise, not just a habit, but now you got to lie down and do clams if that works for you. The butt burners, where you're on all fours and you're picking up your leg. Excuse me. Then we did the standing kickbacks. So you're using your glutes. You're still holding for 10 seconds to get that nerve to muscle connection to improve. Same thing on the mini squats, holding for 10 seconds, also nerve to muscle connection. So for number 8, this is the big one that everybody wants to know about, walking. You cannot just hold muscles while walking. It takes some conscious effort, and it is a symphony of muscles that are working. Literally, if you think about a music band, like think of your favorite band. But think of like the guitarist, the singer, the drummer, the bassist. Maybe there's some other instrument, some backup singers, or the keyboard, something like that. All of those artists, all musicians need to play the right notes at the right time, at the right volume, for there to be a beautiful song played. It's the same thing when you're walking. You're using glute muscles, quad muscles, lower leg muscles, foot muscles, even your core and your upper body's doing something during walking. And all of them need to work at the right times and the right intensities in order for walking to happen well. Now, you've heard a bad band, right? Everybody's been to their kids' recital or their grandkids' recital, and of course you applaud them because they're learning, but it doesn't sound like a Grammy award-winning performance always, right? It's the same thing in your body. I can spot walking that isn't good, that's not the Grammy type performance, but there's ways to improve it. And the main thing that matters most, just like in music, especially with music that requires vocals, singing, the singer makes or breaks the band most of the time. The glutes are like the singer. Your glutes have to be the main thing that you hear or feel in this case when you're walking. When you listen to a song, you often hear you catch the singing. Sure, if you're into music, you might catch the bass lines and the drum beats, and you catch other details of the song. But most people, they catch the lyrics. In walking, you need to be using your glutes. So let me show you how to use your glutes properly while walking. This requires that you have good glute activation, rule number one, and that you aren't dominating the motion with other muscles. So when you walk, let's make some space here. You should, when you step on one leg, begin to bear weight on this leg. As you load your body weight, this glute should tighten up. So now what you have to be able to do is flex one glute without the other flexing. You have to be able to just tighten this side without this side tightening up, and then alternate to tighten this side, and this side relaxes. Because when I bear weight on this leg, only my right glute, I'm on my right foot, my right glute should activate. And then as I step with the left foot, then the right glute's going to relax because I'm taking weight off that leg. Then my left glute's going to activate because now I'm bearing weight on that leg. So whatever leg you're bearing weight on, that glute on that side, on that leg, should tighten up a bit. Not 100%, but like 20 to 50%. Depends on how intense you're walking, how fast you're walking, or if you're walking with something heavy in your hands, or if you're walking uphill or downhill, you need to adjust it a little bit. This requires conscious activation of your glutes, and you have to be able to activate left to right in order to create a beautiful song, to make walking look pretty, and to be mechanically sound, to where you're not feeding into the imbalance and you're not putting too much pressure through your knee joints. Here's the thing: if you're not using your glutes, what are you using to walk? Because you still walked. You still walk down the hallway at your home. You still walk to the grocery store, around the park. You still got on the treadmill. Many of you guys have gone to physical therapy and they say, go get on the treadmill for 10 minutes. You knee arthritis? Let's start on the treadmill. Let's warm up. No instruction on what muscles to use. No idea about these rules. They just want to get you moving however it happens. There's no thought behind which muscles activate. And if you don't know this, then you just walk and you pat yourself on the back and say, I did it. I even bumped up the speed in the incline on the treadmill. You can't use that as your metric of success. What you should use instead is, did you activate your glutes? And when you finish walking, did your glutes get tired? That's the feedback you're looking for. If that's the case, if you got your glutes tired, then you're on the right track. Now, if you're trying to walk right now for exercise to help you avoid a knee replacement, and you're not following these rules, you're not feeling your glutes working, you need to stop. And you should not be walking. And this goes against advice you might be getting from your doctor, from your physical therapist, because there's research studies out there that they're citing at you saying, well, research shows that if you have knee arthritis and you walk more, if you get in, so many thousands of steps, it actually helps with knee arthritis pain. Notice they say it a certain way. They'll say it helps with knee arthritis pain. What they're not saying is it solves the root problem of knee arthritis, because it doesn't. Because there's no coaching on glute activation. But if you can fix your glutes during walking and make your walking a glute dominant activity, a whole new world's going to open up for you. Because now you can add to your situation. You can create a good, let me say it differently. Walking becomes helpful for you. Your everyday walking down the hall of your house, outside your home, in public, wherever you are. Walking now can become helpful for you if it's a glute dominant walking. If you're not making it glute dominant, then walking is harmful for you and you should immediately stop. You should stop walking more than you need to. You should just take it down to the bare minimum, and you should be using a device like this and working your way up to activating your glutes while you're walking so that you can confidently go walking and know that you're not making your knee arthritis situation any worse. Big, big deal. So many of you guys out there have been walking way more than you should at the instruction of a healthcare professional, and they just don't know. They don't get taught this stuff in school. Muscle imbalances, they'll talk about muscle imbalances, but it's very vague. They don't have a way to explain it like I'm explaining it to you. And it's not hard. You guys are getting this. It's pretty straightforward, but they just don't get taught in school. All right, let's go to number 9 here. Now we're getting into some real gym stuff here. I love doing deadlifts. It's number 9. You can see we're making our way over here to the advanced glute exercises, and it's taking us some time. People start over here. They're still in pain in their knees. And what I tell people in our program, you shouldn't be working on deadlifts until you're in phase 4, maybe at the end of phase 3, but definitely in phase 4. Walking, we start to do at the end of phase 2 and definitely more in phase 3 and beyond. But if you're in phase 1, if you go take our quiz and you determine you're in phase 1, you shouldn't be walking. In fact, you should be offloading with some crutches or a walker and working on getting the joint to calm down. We'll deal with walking later. But I just want to highlight that to you, that there's still a lot left to do. So let's come over to the barbell. I'm going to put the table away as well. Give me a quick moment to transition. Thank you guys for sticking with us this far into the live stream. Hopefully you're getting tons of value out of this. Oh, we're over here now? Cool. And hopefully you guys are learning a lot. Ask questions and call the helpline. I think we're still active on the helpline so that you can, we're not, sorry, we're shutting down the helpline. Thank you, Eve and Barbara, for calling. I think there was somebody else too. Anyways, let's do the deadlifts here. So here's a trick on the deadlifts. And obviously this is going to be an advanced exercise, but if you can do this without using a bunch of other muscles, it's extremely beneficial. And you can use small weights as well. Let me go there first. So we have weights here. So these are 5-pound dumbbells. And what I would recommend you do if you're going to start with small weights like this is just put the weights in front of you like so, and look at my legs here. I'm in a squat stance. A deadlift is a squat. It's just that the weights are down here. People in the weightlifting world and the strength training world, they get all hung up on the difference between a squat that looks like this versus a squat where the weights are up here, the weights are on your back. All of the motions have in common that you're bending your knees and your hips. They're the same motion. It's just the weight is put on your body differently. That's why it might feel slightly different. But if you think of them as the same motion, then it doesn't matter. It doesn't matter how you progress because you just need to work your glutes out. You just need to make sure that they're a glute biased activity. So if you're doing the dumbbells, you should be thinking about tightening your glutes on the way up. Tighten your glutes on the way up like that. And when you come down, you need to push your knees outwards and bring your hips forward. The way that looks from the side is instead of dropping or shooting your bottom back out that way, that's not good. You're not using your glutes here. Now you're using quads and back muscles up here. But if you shove your hips forward like this and you're dipping straight down, you're tucking your bottom under your spine the entire time, that makes your glutes work a lot. And that's the way that it should be. And notice I'm not going down super low. If you have the little weights here, it's not necessary to go down so low that it hurts your knees. Just do a mini squat motion, but with weights to make it harder on the glutes. Deadlifts do require you to go a slightly bit lower. I would start with holding the barbell about mid-shin right here, but the principles are exactly the same. I'm going to shove my knees out. Just like if I had the squat, I would go out, but I have to bring my feet closer in because I'm going to grab the bar just inside my legs. But you're going to see that my knees can't open a lot because my arms are in the way. But that's okay. All you have to do is push your knees against your arms. If you have the ability to do weightlifting, if you do deadlifts like so, where you're pushing your knees out against your arms, you will instantly feel your glutes activate and work hard, just holding in this position right here. That's the down position. Once you stand up, you need to tighten your glutes maximally. So here's what it looks like from the side view. As I come down, I'm pushing my knees out against my forearms. And then as I stand up, I'm shoving my hips forward and tightening my rear. Tighten the glutes. And you can see I'm pushing the barbell forward slightly. That's okay, because I'm making my glutes work. I'm making this all about my glutes. So if your reps are always like so, where your knees come out at the bottom and your glutes tighten up at the top, you will make this deadlift motion very much a glute-driven exercise. And you can get very strong in your glutes doing it like this every time. All right. Hopefully that explains deadlifts to you guys. Get a swig of water, and I am sweating now. Second workout of the day. I did my glute exercises this morning along with a bunch of other stuff. Let's see what questions you guys have. Let me finish off my list first, but keep coming in with the comments so we can help you out. All right, so number 10, last one here. I'm going to cover lunges. Definitely advanced. Some of you guys are doing lunges and you're in pain right now. You have knee pain and you're not even sure if you're using your glutes on that exercise. You should not be doing lunges if you can't even do these other exercises earlier. You have no business doing it. And some of you guys get told to do these lunges by healthcare professionals or fitness professionals, or maybe you're just you're watching these on YouTube. You just have to have the understanding of when it's right to do these exercises and when it's not. And those rules that I shared with you, having good glute activation, number one, and number two, making sure that it's always your glutes working most and that other muscles aren't taking over the majority of the muscle burn. So with lunges, I start out without weights, but eventually we'll add some weights. What you have to do, I'll show you the front side first. People, when they want to do lunges, you just make sure you can see my feet here. They'll step forward and often be very narrow in their stance. When you're narrowing your stance and you're dipping down like this to come up, it forces your quads to work quite a bit. But the way that I change this, and it looks different, and a lot of fitness people and healthcare professionals say, oh, you're messing up the lunge. But the point here is to fix knee arthritis, not to make a perfect looking lunge. I think you guys don't want to have surgery. So why make it look like a perfect lunge by somebody's standards out there who doesn't care about your knee arthritis? Let's apply this to knee arthritis. So what I want you to do instead of this narrow stance is get a little wider, almost like a mini squat. Remember the mini squat? You're just doing this right here. But instead of your feet in line sideways like this, we're going to just stagger one forward, stagger one back. But your feet are wide, not narrow like is often taught. You can see the toe tips of my shoes are red here. What I'm going to do is angle them out a bit, not straight forward. Because when you angle your feet out, it makes your glutes want to work better. When you angle your feet straight ahead or even in a little bit, it relatively shuts off your glutes and it makes your quads here want to work. That's not good. So let's angle the toes out. That'll help. Then from here, we're going to do a mini squat, but from a staggered position, 1 foot forward, 1 foot back, and that's a lunge right there. We're calling this a lunge. Right now, there's some fitness professional watching or some healthcare professional watching, just writhing in their seats saying, that's not a lunge. But here's the kicker. Here's what you need to pay attention to. Let me show you from the side view. Is this muscle working better here? And if you have your toes out, your feet wider, and you're thinking about activating your glutes, and you're also not bringing your body forward like this, but keeping your spine over your hips and your hips under your spine, same thing, I just said it differently. If you're lunging this way and then thinking about tightening your glutes on the way up, all of a sudden this becomes a very intense glute exercise. Then on top of that, if you want to add some weights to it, same exact motion, you're getting a heck of a glute exercise. I feel it in my glutes. And I'm pretty strong. I can deadlift quite a bit of weight. And just doing body weight lunges and with these 10-pound weights, I'm sweating already. Then you would switch feet. Same idea. I'm in a wider stance here. You can see my wider stance. Knees out, hips forward to get my glutes active. Bend a little and go up. And yeah, I can go all the way down if I needed to. If I want to do, touch my knee to the ground type of lunge, not necessary. Because what's necessary to fix knee arthritis is that you activate your glutes. Not that you touch your knee down, not that your knees are in line, your toes are in line straight or narrow stance. Who cares? Throw the tradition out because it's messing up your knees. Focus on exercises and modify the exercises so that your glutes are king. If you do that, you will fix your knee arthritis for the long term and avoid a knee replacement surgery. That's what I want for you guys. Who cares about tradition? Who cares about what your fitness instructor wants it to look like? Because truth be told, all of those teachings on exercise have been passed down from generation to generation of fitness professionals who have trained with each other. Thank you. And there's this idea of what a good squat looks like, or what a good lunge looks like, what a good whatever exercise looks like. And they're just thinking about what it looks like, how your body's moving. And that is important. I'm not saying it's not important, but what's a bit more important, if you have knee arthritis, is to make sure the right muscles are firing, which means that your lunge might look different from your friend's lunge. And you might both be firing your glutes, which opens the door for, is it really important that it looks just right? Because maybe that fitness instructor's lunge or squat looks perfect in their eyes, their own squat, but they're not firing their glutes. And they're making you do it like them, so you're not firing your glutes. Or maybe you are. That's the truth, though. You need to figure out which muscles are activating when and make sure it's your glutes to fix your knee arthritis. All right, guys, let's answer some comments before we wrap up. We have a little bit of time left. So I'll just call you Lo. Says, I once dated a girl with a glute minimus. Great. Glad she has a glute minimus, very important for life function. Dr. Lyons says, thank you so much, Dr. Dave. This is pure gold. Oh, I'm glad that this was helpful for you, Dr. Lyons. Kat says, thank you for having this live today. It's been very helpful. Great. Good feedback from everybody. Hopefully you guys benefited. Hopefully you guys are more confident in doing exercises a certain way and telling other people, it's okay, I got this. I'll get my glutes to work. Cindy says, I love our Wednesday live shows. We're on Tuesdays. It's like a pep rally. It seems like it helps me keep focused on what I can be. I so appreciate the whole team at EPMPT. Aww. My team's all bashful over here, Cindy. You're going to make them cry. Thank you for that. Glad you're here with us. Happy to help you. Who else is here? We have Susie. My knee pain comes from having bursitis. That's what my doctor said, and that I need to strengthen my glutes. Good. I'm glad your doctor said you need to strengthen your glutes. And a bursitis is one of the beginning signs that leads eventually to like a meniscus tear, an ACL tear, osteoarthritis as it goes on for longer. So you're lucky if they've just told you have bursitis. That's a big sign, though, for you to fix the glute strength. And if that helps your bursitis, which it probably will, then you're saving yourself from way worse problems by fixing bursitis at the root of the problem. That's good. Laurel says, I was diagnosed with mild osteoarthritis. When I was diagnosed, I could walk very well, but as soon as I commenced PT in a short while, I couldn't walk again due to pain. Please, does that mean the OA has progressed? Likely, but that doesn't mean that you can't get better. It means that you definitely found out which kind of treatment does not work for you. It sounds like they might have made you worse at physical therapy, which is common. So don't panic. You just have to get educated. And that's what we're doing all these videos here for on YouTube and on Facebook and Instagram. So hopefully you guys can begin to get this. It's a process. You have to educate yourself on how to exercise, what rules I'm following here, because this stuff works. We have people cure their knee arthritis all the time. I am confidently saying that now. This is the cure for knee arthritis. Everybody's looking for that magic bullet, that injection, that surgery. But the truth is, there's no magic bullet to fix knee arthritis. It's 100 golden BBs. It's activate your glutes, 1 BB. It's figure out how to stand up from a chair, 2nd BB. It's stand with your glutes activated. All these are BBs that are golden. And when they all happen together, you've gone through the process. Now you're going to fix arthritis for the long term. But it's not one magic bullet. Good comment there. Owen Henderson says, hi, Dr. Dave. Can you help me with rotator cuff shoulder pain? I'm a wheelchair user with limb girdle muscular dystrophy, and I've lost some strength on my left arm due to this. Thanks. Whew. Owen, that's a tough one. Geez, it's tough because you're in a wheelchair and you have to use your arms. The best thing that I would do is you got to calm down the shoulder, the rotator cuff. And that would mean you need to not use your arms as much. And so I don't know if that's possible for you. I don't know if you have an electric chair, if you have somebody to assist you for a while. If you're living by yourself and you're pushing yourself around, you're going to have to reduce how active you are so that you can let that shoulder heal. Then after that, I would look at doing hanging activities. Hanging activities, and we have this in the rotator cuff tear recovery program. We have a program for this. It is gold. And my guess is if you're in a wheelchair, it's rare that people that are in wheelchairs who are mobile by themselves, they can use the wheelchair. It's rare that they're doing any hanging activities, and hanging activities are essential for rotator cuff tear health. I think everybody in the world, as long as you're able, you should be doing some version of hanging from your hands. It is an essential activity that our bodies are designed to do, that if we don't do it, things start to break down eventually. So that's where I think that the best guidance I can give you is. Great question, Owen. No, Miss Ramos, I'll just say Miss Ramos. Unfortunately, I discovered this program after my arthroscopic meniscus tear surgery. Does that mean my knee is doomed? My x-ray shows signs of arthritis on both knees. Am I doomed? No, you're not doomed, Miss Ramos. Sorry you had the meniscus tear and the repair, the surgery afterwards. There's still hope. You can still fix the imbalance. The arthritis program might be appropriate for you now that you have signs of arthritis in both sides. I think you can fix this. We have people in our knee arthritis recovery program all the time who have also had a meniscus tear and surgery, and they get back to being very active and having zero knee pain and super confident that they're not going to have a surgery later on because they know how to deal with this, because this is education based. We are teaching you how to fish rather than just giving you a fish. Medication, injections, and surgery, that's giving you a fish. It's not teaching you how to heal your knees for the long term. That's just helping you for the short term. All right, guys, I'm going to wrap up. Let's read this last comment. Hi, I live in Norway, and I want to help my mother who's 76 years old and suffering from pain due to knee arthritis. She can't walk long distances and hasn't gone to surgery yet. Is there still hope? Ham, your mom has got to want it. I don't know what your mom's like. I have no idea if she's willing. We talk to people all the time that they're kind of settled in having surgery, and that's okay. But this program requires active participation. You have to learn and you have to apply. And if you're not ready to do that, then this program is not for you. And I know some of you guys might want this for your family, like in this case. And you can't make them. They have to do the exercises. You can't do the exercises for them. And that's their decision. So you have to leave them. You have to respect that. You have to leave that to them. But by all means, you can show them these videos. You can show them this comment that I'm answering. You can, hopefully they'll realize what's possible for them. If it is possible for them to heal without surgery, but they've got to want it. So thank you guys all for being here and wanting this and learning this stuff. I look forward to talking to you guys real soon here next week. You'll have a wonderful day.